The fear of seizures. A young woman from New Baltimore struggling with debilitating epilepsy for more than a decade now decides brain surgery is the answer to her prayers.
Her neurosurgeon says the procedure that he's talking about is underutilized, but it is gaining national attention as a way of treating seizures that cannot be prevented with medication.
Our Alicia Smith followed this 24-year-old's journey before, during, and after her surgeries to see how she's doing.
Brenda Cousins is such an inspiration. Our cameras first caught up with her before the surgery in late March, and we should warn you that some of the surgical video you are about to see is graphic and may not be appropriate for all audiences.
This beautiful baby girl could trigger smiles with ease, but Brenda Cousins has struggled to survive from the very beginning. She experienced a stroke at birth, which caused scarring of brain tissue. She was later diagnosed with cerebral palsy. Movement on her left side was affected. Then when she was 13, she started having seizures. The problem continued through the years, even past her college graduation. A life of pain, depression, and anxiety.
I've been to the hospital so many times, I can't even remember. My tonic-clonic seizures scare the living hell out of me.
Her assistance dog, Fletcher, helps her through the attacks, and she takes a series of anti-seizure medications. But the meds are not stopping the seizures.
We're starting the incision.
That's when the option of brain surgery came into play. Watching video of the surgery being done on someone else wasn't easy for Brenda or her mom, but Dr. Chaim Colon, director of neurosurgery at Beaumont Hospital Grosse Pointe, says the first of two surgeries is all about inserting electrodes to find out where the seizures start.
These we would actually penetrate through and into the brain, okay? And then we would leave them there for a couple of days.
I'm excited, but I'm very nervous because I've never actually had my brain operated on.
But Brenda gave them the green light. On April 2nd, Dr. Colon placed electrodes on the surface of her brain. He also inserted 2 depth electrodes deep inside her brain. The goal? Pinpointing the parts of the brain causing the seizures. The team then closed the incision and waited.
Brenda?
3 days later, Brenda had a grand mal seizure, hopefully her last. The implanted monitors caught the crucial spots causing it. Her epileptologist, Dr. Hisanori Hasegawa, joined Dr. Colon on April 9th for her second brain surgery. They removed the sensors, and then they removed the scarred parts of her temporal and frontal lobes that were causing her seizures.
How common would you say the surgery is?
This is unfortunately not very common, and a lot of times I think it's neglected. Hello.
Hello.
Hi.
About 3 weeks pass, and it's time to see how Brenda's doing. Her mom and Fletcher come along for support.
It's very important for us to know if you've had any seizures after the second surgery.
No, I didn't.
So far, so good. She has experienced expected headaches, jaw pain, and lightheadedness, but her doctors are already cutting back on her anti-seizure medicine.
If patient have no seizure for 2 years, then potentially medication may be out.
Brenda would be cured. That's music to her mother's ears.
She got a little scar, but that's minor. I have my happy girl back.
Do you feel a sense of relief, like a weight's been lifted?
Yes, majorly. So I don't have to worry about it. I won't rock myself to sleep anymore.
And her family knows her old sunny smile will shine again.
Again, time will tell if she is cured of her seizures, but doctors are optimistic she can be weaned of all of her anti-seizure medication within 2 years. And we certainly wish her all of the best. In today's Health Edge, Alicia Smith, 7 Action News, back to you.